lot. Let's take a minute and talk about infant skincare next. Now, this is, okay, we've talked about how amazing our bodies are after birth and recovering from the birth. Now we're going to talk about some of the amazing things biology has done for babies. So let's talk about vernix. Vernix is that white coating that your baby has when he's born. I remember with my daughter, she came out and she was just this little, she's like a little butterball. She was just covered in vernix. It was thick and white and just this little butterball of a newborn. It's kind of cheese-like, and it covers the baby all over. So vernix actually fulfills a number of different roles. It's really cool. So it waterproofs the baby while he's inside of you during pregnancy, and it lubricates the baby during the birth. So that idea of, you got the grease pig type of a thing. Well, your baby has a little grease to help her out during the birth. But wait, there is more. Vernix does some other cool stuff. So after the baby is born, vernix takes a role of protecting your baby against bacteria. So we've talked, you hear about how babies have these immature immune systems, but the vernix actually helps them out. The vernix kind of helps fill in some of the gaps of your little baby's immune system at this point. So vernix can actually protect against some really nasty bacteria like beta streptococcus, K. pneumoniae, Candida albicans, and E. coli. So this is why you actually don't want to bathe your baby right away. It's kind of this old school thing. I don't know if it's done as much, but it's kind of an old school thing where the baby be born and then they give the baby a birth in the hospital. They give the baby a bath right after birth, pretty much. My dad talks about how the nurses, after I was born, the nurses were like, "Oh, you want to give your baby a bath?" But that bath will wash away all that really great vernix and its wonderful bacteria repelling powers. So you want to wait at least 24 hours before giving your baby a bath. And that way you can kind of keep some of that vernix on there. It helps protect your baby in the first little bit of life. So next we're going to talk about the umbilical cord. So after the cord is cut, there's going to be a small little stump, and it'll fall off within a couple of weeks. Most of us have seen this. If you have younger siblings, you may have seen in that. I remember when my sister was born, and I saw a little umbilical cord stump, and I kept waiting for it to fall off, and it just fell off, and nobody knew where. And it was just gone one day. But I guess I'd expected it to be a bigger event, and it wasn't. But as long as the umbilical cord is kept clean and it's exposed to air to prevent infection, there shouldn't be any problems. Never had any umbilical cord problems with my babies. One thing you can do is use witch hazel extract from the drugstore or the grocery store. It's a popular remedy for cleaning the stump. Now, myrrh essential oil is another one that's really good for promoting healing and preventing infection. And I've known some moms who use that, put a little bit, dilute it, put a little bit on the stump and around the umbilicus. Make sure the baby's diaper doesn't cover the stump, and make sure there's no t-shirts or onesies or something else that's covering the stump, because that stump needs to be exposed to air to make sure that bacteria doesn't start growing on it. Now, if it's warm outside, you can take him out and get some sunshine too. If you've got one of those summer babies or you live in a place that's sunny year-round, sunshine is a great way to also help prevent infection. But in good amounts. You don't want to take your baby out in the sun too much. But a little bit of sunshine is good. So an infected umbilicus will be very red and tender, and it may exude pus. If an infection does develop, you can give the baby echinacea tincture, 1 drop per pound of body weight once a day, according to Susan Weed. She recommends that you even try slipping the dropper in with your nipple when you're nursing to get the baby to take a little bit. You can also use very well diluted oregano essential oil and apply it topically to the baby's umbilicus and that has been reported to quickly kill infection. But if an infection persists, you really need to get medical attention for the baby. And of course, this is all assuming that the cord has been cut after it stopped pulsing too. Another important part of the baby's umbilical cord is that it delivers oxygen to the baby, even for just a little while after the birth. So After the birth, you don't need to cut the cord right away. Just wait until it stopped pulsing, and that should be good enough for the baby to still get the oxygen, and then but also to get the cord cut in a timely manner.